Or do I, Callie? Yes, I do.
No, you're good.
Classroom. I got it. There we go. Okay. All right, so I'll just keep going. Oh, choose the one single best answer. That's what I'm calling my test. Google. Not looking to look, so I'm going to press it on one. I don't think they do that multiple answer. Multiple answer correct anymore. So, superior thoracic aperture includes which of the following? I drew graphics up there of the region where it's talking about superior thorax. So, not the diaphragm, T12, internal angle. Internal angle is just angle of groove, or second rib, and then we have a body. Going. These are the apertures. Superior thoracic aperture and the inferior thoracic aperture. So for superior thoracic, just think of that first rib, vertebra, and manubrium. Inferior thoracic, think of the diaphragm. And it's the one from the margin. Then it attaches 11th and 12th rib and has a couple of arcing ligaments posteriorly. Which of the following are true ribs? So there's true ribs and false ribs, and this diagram here shows you that the ribs are not all the same. Okay, so top ribs or some of those bottom ribs. So top ribs or bottom ribs? Which ones are the true ribs? Top ribs, yes, because they are attached to the sternum by their own costal cartilages. So 1, 2, 3, 4, 5, 6, and 7 are true ribs. 8, 9, and 10 are attached to 7. 11 and 12 are floating. They're also false ribs. They're just called floating ribs too. The subclavian artery and vein pass over which of the following structures? So this name tells you something about that already because they're below the clavicle. Okay, so that's kind of like a giving question. But so it's over this first rib, but there's a groove for the vein and the artery. Okay, so it's over the first rib, not the second, not over the omohyoid muscle. Here's the omohyoid muscle, by the way. You have superior and inferior belly. It's not over the larynx. Obviously, there's the larynx. This is the subclavian vein, subclavian artery going over the first rib. Vein is anterior to that anterior scaling muscle. Artery is posterior. Also, posterior to this anterior scaling is the brachial plexus, and the cervical plexus is going to be more superior. That's C1 through 5. And you can see phrenic nerve forming on there, C3, 4, 5. Form the phrenic nerve. Okay. The tubercle of rib 7 articulates with what vertebrae? 7 cervical? Yes? No? Okay. 6, 7, or 8. Okay, so you have to remember that the tubercle is going to articulate with transverse process of the same number of vertebrae. Okay. This is showing a typical rib, because some of these ribs are atypical because they don't articulate with 2 vertebral bodies. The typical ones do. And the typical ones, tubercle and inferior demifacet of the head of the rib, articulates with the superior part of the body. So this would be the superior demifacet on the body of 7 cervical vertebrae. And the inferior demifacet of the 6 cervical vertebrae articulates with the superior demifacet of the head of the 7th rib. So that's how they're put together. And then there's the intervertebral disc in between them. All these joints are synovial, but they have a fibrous capsule around all the synovial joints. Okay, so the ligaments are going to be named for what they're going to be connected to. Okay, there'll be costal transverse ligaments, and sometimes they'll be more descriptive. There'll be radiate ligaments that radiate from the head of the rib onto the body. I didn't show them there, but I'm just that I fill you in. Which nerve is in the costal groove? Okay, so you have to remember what the costal groove is. Costal is a word that refers to your ribs. We got many nerves: the vagus, the phrenic, the recurrent laryngeal, and then an intercostal nerve. Okay, so the intercostal nerve will be on the inferior edge of the rib and where there is a groove. I put this diagram in here because I like the way it shows the arrangement of the spinal nerves with the spinal cord, and then the intercostal nerves traveling between the layers of the intercostal muscles. So you could look at this and get a lot of information just from one slide. So we have a dorsal rim, dorsal roots and ventral roots coming together and make a spinal nerve right here. Immediately branches into a dorsal ramus and a ventral ramus. And in the thoracic region, those become the intercostal nerves. The dorsal ramus is going to be providing motor, sensory, and sympathetic and parasympathetic innervation to the structures, not parasympathetic, sympathetic innervation. The blood vessels only have sympathetic innervation, okay? To the area around the vertebral column. So the muscles and the skin back here too. Okay? The ventral ramus is going to supply the entire remainder of the body, okay? Or I should say body wall. So the spinal nerve is going to be innervating the body walls. So the abdominal body wall, thoracic body wall, the wall of the pelvis and those muscles, also the extremities and the neck and the visceral cranial structures and the muscles that are external to the cranium. So those will be the spinal nerves. The way sympathetics get into these spinal nerves is through the sympathetic trunk, which travels along the lateral surface of the vertebral bodies, and it's connected by rami communicants. There will be two of them in the region where the preganglionic nerve cell bodies are located, and that would be T1 to L2 or 3. They're going to be, if I can zoom in here. Well, if you can zoom in right there, behind this line, you'll see a little point between the ventral horn and dorsal horn of this cross-section of the spinal cord. That's the intermediolateral cell. And from T1 all the way down to L2, sometimes 3, there will be the nerve cell bodies of the sympathetic nervous system, preganglionic fibers. The ganglia are going to be paravertebral here, or for abdominal structures, prevertebral. Okay? And the way these preganglionic fibers are going to get to these paravertebral ganglia are going to be through white rami communicants, gray rami communicants are going to send the postganglionic fibers out to the intercostal nerves. Or should just say spinal nerves. Because for the dorsal rami, they're going to handle this path into those nerve branches. You'll also see other branches from these ganglia. These are the paravertebral ganglia. These are going to be greater splanchnic nerves. Those are the ones that are passing through the sympathetic trunks, going to the prevertebral ganglia in the abdomen. They're not going to synapse here, okay, and then send branches back into the intercostal nerves, going to go down to the abdomen. Okay, so what you know for sympathetic, well, the autonomic nervous system, which is sympathetic and parasympathetic, is going to be two nerves in a nerve fiber pathway. Okay, so it's going to be a ganglia situated somewhere. And I have a slide that actually talks about, reviews that idea. Which of the following passes the parietal pleura to the thoracic wall? Oh, I have 5 choices. I put 4 choices because that's the way it was going to be on your boards. I forgot I put 5 choices here. So which of the following passes the parietal pleura? So you have to know what pleura is. It's a membrane to the thoracic wall. And the answer is endothoracic fascia. Okay. Here is the pleural membrane. If you remember this diagram, the pleura is a closed cavity. It's called a pleural cavity. And part of that cavity encloses this representation of the lung, which as it grows invaginates and almost obliterates the space that closed cavity was making up. So this part is the parietal pleura. That'd be this part here, and then the visceral pleura is wrapped on the surface of the lungs. Okay. So the visceral and parietal pleura are continuous right here at the hilum. That's where the structures go into the lung. And then there's fascia between the hilum, between the hilum and the body wall. And so it's not just an empty space between the pleura and the body wall. There's fascia connecting everything together. That fascia is endothoracic fascia. Loose fibrous connecting tissue. So it's this dotted line right here. So as you're pulling the pleura away, all those little fibrous connections are trying to hold it onto the body wall. That was the endothoracic fascia. And the top part is partly extends into the superior thoracic outlet, superior thoracic aperture. And so this part right here is a thickened area of that endothoracic fascia. Okay? Yeah. Over what's what's called the apex of the lung. Sometimes this area is called the cupula, like a little cup on top of the lung. So there is no lung inside the throat cavity. Just a little bit of throat fluid allows the lung to move around without damaging the lung. So the anterior rami of nerves 1 through 11, I didn't include 12 because 12 is not an intercostal nerve, are also which of the following? And I just gave the answer. They're intercostal nerves. Okay, those anterior rami of T1 through 11 are not rami communicans, that's what connects the sympathetic ganglia, the sympathetic trunk, no, the thoracic flangic nerves. I already showed you where those were. They're the intercostal nerves, those anterior rami, okay, of T1 through 11. And T12 is the subcostal. And here it is again, going in through the layers of the intercostal space. And those layers are the innermost intercostal, the internal intercostal, and the external intercostal. And the space between the innermost and internal intercostal is called the neurovascular plane. Let's see, I already went, one thing I didn't go over is these are the roots that are forming this spinal nerve. The ventral root is attached to this ventral horn where the nerve cell body is located, right matter of the spinal cord. So this is the motor root. This is the dorsal horn. This is the sensory root. The sensory root, sensory neurons have pseudo-unipolar type of nerves, okay, which means they have a cell body that has one axon that divides into two, okay? One of those axons, so the nerve cell bodies are right here in these spinal nerves. They're called the dorsal root ganglia. So one of those branches of the axons is going to go into this spinal nerve and then into the cutaneous branch here and then go to the skin sensory receptor. The other branch is going to divide and go into the dorsal horn of the spinal cord. So pseudo-unipolar neurons are sensory type neurons. There's only one ganglia and it's located outside of the central nervous system in the dorsal root ganglia here. And if you're in my head and neck talk, there are analogous structures in the cranial nerves that act as these dorsal root ganglia, but for the cranial nerves. Tomorrow I'll talk about the head and neck. If you want to come back, we'll talk about which of those. One of the big major ones is trigeminal ganglia. Okay. There's also the genicular ganglia and the facial nerve, but I don't want to get too off track. So for the spinal nerves, we have these dorsal root ganglia. Okay. That's where the sensory fibers are. And then they become mixed spinal nerve, and then those fibers travel into these ventral and dorsal rami. The internal thoracic artery is a branch of which of the following vessels? The aorta, axillary, subclavian, or pericardiophrenac artery. Okay, so those can be all likely choices. However, here are the internal thoracic arteries. They're forming the anterior roots of the vessels that are going to become the intercostal vessels. Posteriorly, the vessels will come from the aorta, which are what I just mentioned, the intercostal vessels. Anteriorly, the internal thoracics are going to be branches of the subclavian arteries. The branches that were a choice were the pericardiophrenix. The pericardiophrenix are branches of the internal thoracic arteries. And the name tells you what they're going to supply, the pericardium and parts of the diaphragm. So they're going to travel, as you can see here, with the phrenic nerves. Okay? So pericardiophrenix are going to travel with the phrenic nerves in that space between the pericardium and the pleura, and the branches of the internal thoracics. The internal thoracics provide the anterior intercostal vessels, which are going to anastomose with the posterior intercostal vessels that are coming from the aorta. So the branches of the subclavian arteries. And here's another diagram that shows you how the blood supply to the thoracic wall is formed posteriorly from the aorta. Then you have anastomosis, approximately the anterior axillary line. The internal thoracic produces branches that form the intercostal vessels. Superiorly, the aorta doesn't extend up to these intercostal spaces, the first and second intercostal spaces. I put this in here, the supreme intercostal vessels come from what's called the costocervical trunk. It's a branch of the subclavian arteries. The first branches of subclavian arteries are going to be your, well, the vertebral, thyrocervical trunk, costocervical trunk. Okay. From the costocervical trunk will come the supreme intercostal, so it'll supply the first and second intercostal spaces with the anterior branches coming from the internal thoracic that will anastomose. You see the aorta doesn't extend up that high to these intercostal spaces, but it produces these lower ones. Okay. So this gives me a chance to go over the branches of the abdominal aorta too. So the aorta arches over to the left side and becomes, the first part is the ascending, then you have the arched aorta, then you have the descending or thoracic aorta, and the main branches of the arch of the aorta. Oh, okay, I don't want to get too distracted sometimes. The first branches of this aorta are going to be what? The coronary arteries, just to let you know. The coronary arteries is going to supply blood to the heart first thing. And then the arched aorta, its first and major branch, biggest branch is going to be this brachiocephalic trunk. Because it arches over the left side, it has to send a trunk over to the right side. Okay? So that your subclavian and common carotids can branch off at approximately the same location and go to the right and left sides of the neck. But you need a little spacer here, the brachiocephalic trunk to get over to the right side. So branches of the brachiocephalic trunk are going to be the common carotid and the subclavian. Directly from the arched aorta on the left side is the common carotid and the subclavian. So the left side has the left common carotid and the left subclavian. Which of the following provides lymphatic drainage of the lower extremities? Okay, azygous vein, right lymphatic duct, hemiazygous vein, thoracic duct. Okay, so you have to remember that picture of that guy. Yeah, there he is. That has this right upper quadrant of his body highlighted here in pink. This part of your body, above the diaphragm on the right side, all these lymphatic vessels that are draining your interstitial spaces between all your cells and tissues go ultimately to the right lymphatic duct, at what's called the right venous angle. What's the venous angle? It's the angle that's formed by the internal jugular vein and the subclavian vein. Okay, it's going to come together on the right and the left side to form the brachiocephalic veins. And the right lymphatic duct drains this part, right side above the diaphragm. Thoracic duct with all these branches, this long vessel here, everything else. Okay. Which lung lobe has a structure called the lingula? Remember the lingula? Okay. Superior lobe. You just got to remember that they're different because there's a heart that sort of takes up some space, so not as much can develop on one side as the other. The heart develops over to the left side, so remember that. So you got left lung, superior lobe, middle lobe, inferior lobe, or superior lobe of the right lung. Does the left lung have a middle lobe?
No.
Right. Okay. Yes. Okay, so we got the left lung and right lung. We have oblique fissures on both the lungs, but the right lung has a horizontal fissure. Okay, so there's three lobes. Upper, middle, lower lobe on the right. If you look at these oblique fissures, they're at an angle. So the superior lobe of both lungs is mostly anterior. The inferior lobe is posterior. So when you're listening with your what's that thing called? Stethoscope. When you're listening to the chest with the stethoscope, make sure if you want to listen to the superior lobe, you listen to the anterior chest. If you want to listen to the inferior lobe, listen to their back inferiorly. Let's see. And you see the heart is in its pericardial sac, and it develops over to the left side. About 1/3 is over to the left side, 2/3, 1/3 over to the right side, 2/3 over the left side. So this left upper lobe has a gap here called the cardiac notch, and then a little tongue that extends inferiorly. That's the lingua. That's what was the remnant, what could develop of the middle lobe of the left one, but never did develop. Just has a little tongue. So there would be the lingua. Which of the following is contained in the pleural space? The trachea, the heart, the lungs, or some pleural fluid? The answer is pleural fluid. Okay, so I put this diagram here to show you that these are the pulmonary cavities. All this stuff in the middle is the mediastinum. Okay, two pulmonary cavities, take, almost fill the lateral parts of your chest. And then this black line is the pleural cavity. In there is a thin film of pleural fluid. The lungs almost completely fill the pulmonary cavity, but there's just a thin space, the pleural cavity. A little bit of pleural fluid allows the lung to expand and contract without damaging. Okay. The phrenic nerve supplies motor fibers to which of the following muscles? Okay, sternocleidomastoid, trapezius, diaphragm, or pectoralis major. Phrenic nerve is part of the cervical plexus. It is formed by the ventral rami of C3, 4, and 5. So this was that neurovascular plane between the anterior scalene and the middle scalenes, where you had your subclavian artery, brachial plexus, and I said some cervical plexus nerves, C1 to 5. We'll pass posterior to the anterior scalene. C3, 4, 5 come together on the surface of the anterior scalene, pass posterior to the subclavian veins, and through the space between the pleura and the pericardium. They have sensory fibers to the pericardium and the diaphragm, and motor fibers to the diaphragm. Other nerves you can see here are the vagus nerves. Okay, they'll be medial to the phrenic nerves. They'll be in the carotid sheath. Here's the carotid arteries. They'll be in the carotid sheath. Those are medial to this neurovascular plane that's lateral to the anterior scalene. That's where the cervical plexus, brachial plexus, and the subclavian arteries are going to be found. So the vagus nerves will be medial to that. Okay. Which of the following nerves loops around the aortic arch? Would it be left recurrent, right superior, left superior laryngeal? Remember, the aorta arch is to the left side, so it's left recurrent laryngeal. So this is the posterior view, and so the aorta is going to be arching over to this left side. This is the posterior view. Okay. The vagus nerves are in the carotid sheath, and this is what are the main structures that are going to be contained within the carotid sheaths. The carotid arteries, the internal jugular vein, and the vagus nerves. Okay, on both sides. These are the superior laryngeal nerves. They're going to go to the larynx. The recurrent laryngeals are going to come from inferior in a groove between the trachea and the esophagus. Because we have the arch of the aorta over here on the left side, the left vagus is going to send a recurrent branch around the arch of the aorta. On the right side, there is no arch of the aorta, so that branch is going to loop around the right subclavian. Okay, and those are both of those vessels are going to the larynx. Okay, provide sensory and motor function for the laryngeal structures. Okay. Which of the following returns oxygenated blood to the heart? Aorta, pulmonary veins, pulmonary arteries, pulmonary trunk. Okay, the arteries are branches of the trunk, so using that kind of logic, you can, if that's not the right answer, you can just eliminate those 1, 2 right away. And those can be eliminated right away. Because this diagram shows the blue and the red side of the heart. The blue side carries deoxygenated blood into the heart chambers. The red side carries oxygenated blood. Okay, so the blue side is the right side of the heart that receives venous blood from the superior vena cava and inferior vena cava into the right atrium, into the right ventricle, through the pulmonary trunk, and through the left and right pulmonary arteries to the lungs, where it's oxygenated. Back through the pulmonary veins, that's where the oxygenated blood goes back to the heart. So that's the answer. That goes into the left atrium, left ventricle, and out to the aorta, to the body. Then the cycle repeats over and over. So the right side is the pulmonary circuit, the left side is the systemic circuit. Okay. Which of the following was open during prenatal life, and then, I should say then, became a fibrous ligament after birth? So is it a normal phenomenon? Was it the thoracic duct? No, you needed that after birth, right? Ligamentum arteriosum, falciform ligament, pulmonary ligament. Well, it would be one of these ligaments right here. Is prenatal circulation. So before you're born and after you're born, things change. Because your lungs aren't functioning, there would be a placenta out here when you're a developing fetus, and there's blood vessels traveling to that placenta. From the baby's body, after the tissues have used oxygenated blood, they travel through these two arteries, two pulmonary arteries. These arteries, two pulmonary arteries, no, two umbilical arteries, okay? Umbilical arteries come from the iliacs. Specifically, if you really want to know, they're the anterior division of the internal iliac arteries, okay? So it has deoxygenated systemic blood from the fetus, okay, going to the placenta. So automatically see that circulation is a lot different than the adult. Two umbilical arteries carrying deoxygenated blood to a placenta, and oxygenated blood coming back through one umbilical vein, which travels through the umbilical vein posterior to the liver, past a connection that goes from the portal vein over to the inferior vena cava. So the whole point of getting this oxygenated blood to the inferior vena cava is that's where the heart is. You got to get it to the heart so that it can be pumped into the aorta. So the lungs aren't functioning. So there are some openings in the heart itself that allow that oxygenated blood to get over to the aorta. One of them is called the foraminal valley. So blood comes around this inferior vena cava through the foraminal valley, and through the foraminal valley you can go into the left atrium, left ventricle, and out to the aorta. Blood that goes through the right atrium from the inferior vena cava can go through the right ventricle and goes through the pulmonary trunk, but then there's an opening there as well that goes into the aorta. It's called the ductus arteriosus, okay? Connection between the left pulmonary vein near the pulmonary trunk that goes to the arch of the aorta. So an opening in the interatrial septum, a connection between the pulmonary trunk and the arch of the aorta allows oxygenated blood from this inferior vena cava to get into the aorta, and then the cycle repeats itself. So these parts here, this umbilical vein, I didn't mention that posterior to the liver, the connection between the inferior vena cava and the portal vein is called the ductus venosus. That's the ductus venosus. The ductus arteriosus is between the pulmonary trunk and the arch of the aorta. The whole idea was to get oxygenated blood to the inferior vena cava. Okay. So after you're born, these structures become ligaments, and this foramen becomes fused. Okay, it just leaves an obliterated fossa. It's called the fossa ovalis. This ligamentum arteriosum was the ductus arteriosus, and the ligamentum venosum was the ductus venosus, and then the obliterated umbilical vein was is called the ligamentum teres, or round ligament of the liver. That was the umbilical vein that came from the placenta. The umbilical arteries also become fibrous. Okay. And they turn into the medial umbilical ligaments. There's, I think, I don't know if I have a slide, but there's 6 folds on the anterior abdominal wall: median, medial, lateral, and false. I think I have a diagram that shows where these medial umbilical ligaments are located. But that's where the umbilical arteries have peritoneum folding over on the anterior abdominal wall, going to your belly button. Here it is. Okay. All right. So here's the obliterated ends of the umbilical arteries. You see you have 2 of them. Then you have the 2 lateral folds. That's where the inferior epigastric vessels are going to join the superior epigastric vessels in the rectus sheath. Then you have this one median umbilical fold going to the belly button. That drained the urinary bladder when you were a fetus in a structure called the urachus. And the umbilical vein came up through here. The peritoneum wrapped around it. This part's called the falciform ligament, and this obliterated umbilical vein is the round ligament of the liver, or ligamentum teres. In the adult, which one of the following is usually open during diastole? So in the adult, which is usually open, so ductus arteriosus, is that usually open in an adult? No. Mitral valve, aortic valve, pulmonary valve. Right. So diastole is part of the cardiac cycle. That's ventricular relaxation and filling. Okay, so for the ventricles to fill, those valves that are open to the pulmonary trunk and the aorta close so the ventricles can fill. Okay. The valves between the atria are then going to open, atrioventricular valves. Okay? On the right side, it's called tricuspid. On the left side, it's called the mitral valve. So those are two valves that are going to open. And that corresponds with the love sound, the more quiet sound, ventricular relaxation I'm building. And the other part of the cycle is systole. Okay? During systole, there's ventricular contraction. Okay, so these valves coming from the atria are going to have to close, the mitral and the tricuspid valves. And then the semilunar valves that are between the pulmonary trunk and the aorta are going to open. So when these two valves close, that's the dub part. So dub, 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 dub. Those two valves are going to close, and these two are going to open. Blood's going to go to the lungs, blood's going to go to the aorta at the same time. These systole and diastole occur on both sides of the heart at the same time, synchronously. All right, and this is just another diagram that shows during diastole, ventricular relaxation, these valves have to be open. And this also shows the orientation of these vessels. Anteriorly, that's where you have your arteries. Okay, this is the pulmonary trunk, that's the aorta. First branches, like I said, were the coronary arteries. And you see that it's during relaxation phase where those valves, on the semilunar valves, are out of the way of the openings of the coronary arteries. So during relaxation is when the coronary arteries fill, okay, during diastole. And this is systole, because these two big arteries are opened and allowing blood to go to the lungs and body. These two are closed, okay, so the blood doesn't regurgitate back into the atria. Okay. Tricuspid valve and mitral valve, those are the atrioventricular valves. Okay. Which of the following arteries is located in the anterior interventricular sulcus of the heart? The aorta, the posterior interventricular branch of the right coronary, the anterior interventricular branch of the left coronary, or the circumflex branch of the left coronary. Well, let's just get right to it. This is the anterior ventricular sulcus between the right and left ventricle. So we see where that comes from is the left coronary artery. There's the right coronary artery. This is called the coronary sulcus. Separates the atria from the ventricles that are inferior. This is the pulmonary trunk. There's the aorta. Superior vena cava. This is the left atrium. So the left coronary has two main branches, anterior interventricular and the circumflex branch. The right coronary, you see there's a lot of branches, but these are the main branches. The right coronary has branches that will go in the coronary sulcus to the posterior side of the heart and produce another main branch. So you see the left coronary is going to provide most of this blood supply to the left ventricle, which is over on this side. The right coronary is going to supply the branches that go to the conduction system of the heart, the SA and AB node, sinuatrial and atrioventricular nodes, okay? That which causes that rhythmic contraction. It's those conduction system periodically send a signal for contraction to occur. If you look at the posterior heart, you can see the venous drainage of the heart. It goes into the right atrium, just medial to the inferior vena cava opening. This is called the coronary sinus. Go back to the front. This is the great cardiac vein. It's going to go to the posterior side of the heart and then join the coronary sinus. We have a middle cardiac vein and a small cardiac vein, and those would be the main drainage for the heart into the left atrium. Here's that right coronary and the coronary sulcus. It goes in the posterior interventricular sulcus between the left and the right ventricles and provides blood supply to the main blood supply for the posterior part of the heart. It's going to anastomose with a circumflex branch, usually, coming from the left side. Which of the following connects the sympathetic trunk and spinal nerves? Okay, so we already kind of talked about this. Rami communicata, the spine next, or the ligamentum arteriosum. So we have autonomic nervous system, consists of sympathetic and parasympathetics. I asked about the sympathetics. Okay, the sympathetic trunk travels from the cervical, superior cervical ganglion all the way down to the last ganglia, called ganglion impar, on the sacrum. Okay, the fifth sacral ganglion, sympathetic ganglion. They're paired trunks, one on each side of the vertebral bodies. From from T1 to L2 or 3, there are going to be two rami communicans that connect your spinal nerve to your sympathetic trunk. Okay, two rami communicans with the white rami carrying presynaptic or ganglionic, means the same thing. Ganglion nerves are bodies in the periphery. So you have paravertebral and the prevertebral ones are the ones that are going to your abdominal organs. Okay. Paravertebral are going to send postganglionic fibers. So you see postganglionic fibers traveling to the organs, but also they're going to go into the spinal nerves through another rami communicans called the gray rami communicans. That's why there's two of them. Gray rami communicans are going to be present at every vertebral level. White rami communicans only where the presynaptic nerves and bodies are. T1 to L2 or 3. All right, you can see the rami communicans here. There's also going to be some, you can't see I just repeated that the gray rami are at every level of the spinal cord. Okay, that's where postganglionic fibers come from. For example, the superior cervical ganglia. The presynaptic fibers will come in through a white rami communicans and travel up the sympathetic trunk. And the gray rami will send postsynaptic fibers from the superior cervical ganglia, which supplies a sympathetic nerve supply for the head. Okay. The autonomic nervous system has a little bit different distribution. Its ganglia are in the periphery, but it's organized a little bit different than prevertebral and paravertebral ganglia. In the head, there's 4 ganglia, okay, and 3 cranial nerves that are going to synapse on those 4 ganglia. 3, 7, 9, and 10 are the ganglia that have parasympathetic nuclei in the brainstem. Okay, 10 doesn't synapse on any of those ganglia in the head. 10 travels out of the jugular foramen, and then it's, because remember I said there's got to be 2 neurons in a nerve fiber pathway for the autonomic nervous system. Its ganglia for 10 are in the walls of the organs themselves. They're intrinsic ganglia. Okay, so it'll send fibers to the thorax and abdomen. It'll synapse there, and then a short fiber will go to the organ itself, all the way up to approximately the spinal flexure. You see down here, we have S2 through 4, which will form the pelvic splanchnic nerves. Those are parasympathetic nerves. They have intrinsic ganglia in the organs from the splenic flexure all the way down to the end of the GI tract, and also the pelvic organs. So there's intrinsic ganglia in those from the splenic flexure all the way down to the pelvis. And that comes from S2 through S4 to the pelvic splanchnic nerves. Okay, let's see. So 3, 7, 9, and 10. 3, 7, and 9 are going to synapse on 4 ganglia in the head. Ciliary, pterygopalatine, otic, and submandibular ganglia. And this diagram here shows you which synapse is on which one. Okay. The facial nerve, 7, is going to synapse on 2 of the ganglia, the submandibular salivary gland secretion, and the pterygopalatine for lacrimal gland. Talk more about the cranium, the head, next up tomorrow. So I want to go back here again, because I talked about the paravertebral ganglia, but not the prevertebral ones. And I said that from T1 through L2 or 3, that's where preganglionic fibers synapse on these ganglia here, and then the fibers will travel up or down, and then synapse on the other ganglia. Okay. However, for these prevertebral ganglia, the preganglionic fibers don't synapse. They pass through these paravertebral ganglia and synapse on the ganglia in the abdomen. Okay, so they just pass through. These nerve fibers here are called the thoracic splanchnic nerves. There will be a greater, lesser, and least splanchnic nerve, and they're associated with vertebral levels for the greater splanchnic, T5 through 9 or 10. Lesser splanchnic will be 10 and 11, and least splanchnic will be T12. Okay. That's why they're called thoracic splanchnic, because it comes from the thoracic region. So our thoracic splanchnic nerves, we see them passing through the sympathetic trunk. They'll pass through the diaphragm and then synapse on those prevertebral ganglia. And then how do the postganglionic fibers get to the abdominal organs? They travel along the blood vessels. So if you can remember where these greater less release spinal nerve synapse, then you just need to know where that blood supply travels to. Let's see. For example, greater spinal nerve synapse is on the celiac ganglia around the celiac trunk. So you got to remember what the branches of the celiac trunk are, and that's from the organs that are going to receive innervation from T5 through 9 or 10. The greater spinal. Which vertebral level does the thoracic aorta enter the abdomen? Through the aortic hiatus. 9, 10, 11, 12. 12. Okay, right there. Aorta is most posterior, esophagus at 10, inferior vena cava at 8. Those are the three main large apertures through the diaphragm. Which vein forms the anastomosis that joins the SVC and IVC? Is it synovial vein, internal jugular, esophagus, or superior intercostal vein? Okay. So let's see. Is it this one? Remember how that one worked? Yes, it is that one. Okay. So here's the superior vena cava. Here's the inferior vena cava. All right. So the azygous vein is on the right side. It'll connect with the superior vena cava, drain the thoracic body wall. It also drains the lumbar region because you have lumbar veins that will pass through the diaphragm because they're connected to an ascending lumbar vein. So these are lumbars. And the ascending lumbar vein, as it passes through the diaphragm, just changes its name to the azygous vein. It'll connect with the superior vena cava. The ascending lumbar vein also connects to your common iliac vein. So there's the anastomosis between those two. On the left side, it's a little more variable, but you have the same arrangement on the left side up to about the 9th vertebral level, and this is called the hemiazygous vein here, and that'll pass over and connect to the azygous. Then you have accessory hemiazygous in the mid region, T5 through 8, and then the superior intercostal on both sides will drain the superior intercostal spaces to the brachiocephalic hemiazygous. Which muscle forms the deep muscle layer of the anterior abdominal lateral wall? Abdominal wall. The deep layer, external, internal, transversus for the psoas. Transversus abdominis. Okay. You have two vertical muscles. Those are the rectus muscles, rectus abdominis. Then you have three muscle layers here on the lateral side. They will form a sheath that will wrap around those two rectus abdominis muscles. Okay. Hold on. They'll wrap around those rectus abdominis muscles. That's called the rectus sheath. So there's a line separating that rectus abdominis from these three layers right here. You have an external that's cut. You can see the internal oblique here, and the deepest layer will be transversus abdominis. You can see the three layers here. Transversus abdominis, internal oblique, external oblique. They end right here in the epinerosis called the rectus sheath. Inferiorly, they form the external oblique forms the inguinal ligament that goes from the pubic tubercle to the ASIS, anterior superior iliac spine, and at the inferior end of the internal oblique and transversus abdominis, there's an opening. That's the deep inguinal ring. It's about the midpoint between the ASIS and the pubic tubercle. It's about 4 centimeters long, and it passes, and then it forms the inguinal canal through which its splenic cord passes. The canal is made by the external oblique, which you see folded and cut here, but when that folds over and attaches, it forms a superficial ring. The umbilicus is here in a line called the linea alba, which joins the two rectus sheaths together in the midline. Femoral vessels pass inferior to the inguinal. Okay. I'm almost out of time. But I'm going to keep going until one of those professors or a mob throws me out, I guess. So here's the diaphragm. I said that all right, so I'll just go over some of these muscles. You see how the diaphragm is attached. It's going to be attached to the costal margin, and this area is called thoracolumbar fascia. It's going to pass over a quadratus lumborum muscle and the psoas major muscle. It's going to make a medial and lateral arcuate ligaments. This is the transverse process of L1 that's attached to. This is going to be the 12th rib tip right here. The psoas major and iliac muscles sometimes form the iliopsoas muscle, which is attached to the femur. Psoas minor is sometimes present, sometimes not. It is attached to a long tendon to the iliopubic eminence. They all help with flexion of the trunk. The posterior layer of the rectus sheath is absent at which location? Arcuate line, above, below, above the umbilicus, or below the linea alba, which doesn't make any sense because that's a vertical line. So you can toss that one out. So what is the arcuate line? Below the umbilicus, that's not the arcuate line, but you have the three layers that were forming the rectus sheath. Well, I'll start above the arcuate line first. This middle layer, the internal oblique, it was split and it was passing anteriorly and posteriorly to the rectus abdominis. This would be the linea alba medially, this line right here. At the lateral edge of the rectus abdominis was the linea semilunaris, or semilunar line. That's where all these aponeurosis were coming together, external, internal, and transverse abdominis. Below the arcuate line, there was no splitting of the internal oblique. They all passed anterior. Okay, so this is what it would look like. Posteriorly, there's the arcuate line. Here's the rectus abdominis and part of the rectus sheath. If you look from posterior view, looking anteriorly at the abdominal wall, there's the arcuate line. This is transversalis fascia. That's endo-abdominal fascia that's attaching this peritoneum you see on this side to the abdominal wall. So as that peeled away, you can see the posterior layer of the rectus sheath. Okay. That's where the transversus abdominis and internal oblique are divided into the posterior rectus abdominis. Okay. The aponeurosis of which muscle forms the superficial inguinal ring? External oblique. Okay, right here. This is the well, the internal oblique muscle has been cut here. Here's the inguinal ligament, but this part right here, let's see, yeah, this is a little bit better. This shows the external oblique. There's the three layers: transverse abdominis, internal oblique, and external oblique. And you see they cut and open. So this would be the superficial ring right here. The parts of this inguinal canal to know are going to be from this inguinal ligament. There's going to be ligaments that go down to what's called the pectineal line of the pubic bone. That's called the lacunar ligament. Where it connects to the pectineal line, that's called the pectineal ligament. These two muscles, internal oblique and transverse abdominis, their tendons join together and make the conjoint tendon or inguinal fall. Here is just transversalis fascia and peritoneum. So that's a weak area, just lateral to that. So that's a site for indirect hernias to pass through. What you see here are the inferior epigastric vessels. If you look posteriorly, you can see the deep inguinal ring, which is right there, anteriorly, is lateral to the inferior epigastric vessels. That's the site of indirect hernias. This is called the vessel duct triangle, bless you, between the pectineal line, in the inferior epigastrix, and the semilunar line. So that's this area right here, where you just have transversalis fascia and peritoneum. Sometimes it's a big space. So increased intra-abdominal pressure can produce indirect hernias. Okay? Direct hernias. Direct hernias. Indirect hernias go through the deep inguinal ring, lateral to the inferior epigastrix. All right. Am I out of time?
I just got to roll because Porter takes.
I got a class right now.
Thank you, Dr.